All models of any kind, in any situation, of any stripe, on any platform, artificial intelligence, neural network, machine learning, statistical, probability, physical, whatever, any model only says what it is told to say. So we just have to be very careful about defining first what is right, what is good, what is the meaning of the good, what is bad, what is evil. We shove all aside to start telling people to learn science instead, and that's a complete mistake, because the scientist comes to believe his own press and his own PR.
Okay, welcome to the Manipulation Check. We have a very, very special guest with us today, Dr. W.M. Briggs, statistician to the stars, possibly the world's first and only world famous statistician. I try and fact check that. I think try and prove me wrong.
If it isn't, it should be true.
You can check them out at wmbriggs.com. Lots of information on there. And what I'm going to do now is I'm just going to read off a description from his website, because I think it's so good. It's way better than anything I can ever come up with. So I'm going to modify it a bit so it sounds like I'm the one saying it, or I'm the one who wrote it in the first place. But just so you know, you can find this at wmbriggs.com. So he is a wholly independent vagabond writer, statistician, scientist, and consultant. Previously a professor at Cornell Medical School, a statistician at DoubleClick in its infancy, a meteorologist with the National Weather Service, and a sort of cryptologist with the U.S. Air Force, formerly Staff Sergeant Briggs. He got a PhD in mathematical statistics from Cornell, though he is now a data philosopher, epistemologist, probability puzzler, unmasker of over-certainty, and self-awarded bioethicist. He has an MS or his master's in atmospheric physics, I can't even say it, and a bachelor's in meteorology and math. He's the author of several books. Everything You Believe Is Wrong is his latest. Prior to that, it was The Price of Panic, How the Tyranny of Experts Turned a Pandemic into a Catastrophe, and also Uncertainty, The Soul of Modeling, Probability, and Statistics, and also the author of a large number of other manuscripts and publications as well. So welcome, Dr. Briggs.
Thanks for having me.
So let's start with our questions here, and perhaps we can start by talking about expertise. And you've written about the cult of expertise and the tyranny of experts, and that's from your books. What do you mean by these concepts, and what is required to be an expert in society today?
Well, this is an extension. It's not my idea originally or anything like this. I like the name experts for the class of people who are credentialed and have training, but who work and support the regime in one way or another. This is just an extension of the managerial class, which has been discussed at least since Burnham back in 1941, James Burnham, and more lately by other authors. It is the extension and the growth of this, what we might even call the Zoom class, of people who exist entirely by this world of fantasy that they concoct, that they create, that they supply. The experts in particular, I use the term experts all the time with a capital E, because I don't like manager. Manager nowadays, in modern English anyway, sort of conjures up somebody at a department store or something like this, assistant manager. No, these are the people who are university professors and the like, people in the bureaucracy, all these over-credentialed, over-certain, hubristic people that are running things for us. So the way it kind of works is the government or the oligarchy sort of asks for a solution. They want to have a particular implementation of some policy, which we could just call solution to some problem, real or imagined. And the experts provide the science, not science, but the science. The science is different from science. The science starts from the conclusions and works backwards to try to find evidence that backs up the conclusions that are desired, which can always be done. And the cleverer you are, the better you are at this, and the more that you'll be rewarded in this sort of expertocracy. And you can always distinguish between real science and the science, because when you question real science, someone might say, well, I think you're wrong about this, and maybe the cause of X is Y and not W or something like this. You'll get into some debates about the actual physics or the actual parts of reality you're trying to describe the causes of. But when you question the science, you're called a denier.
Yes.
You can't question the science. You're a denier because the conclusion has been given up front. The conclusion is just true. It's accepted as true. Therefore, they are quite correct in labeling you a denier because you are denying that conclusion.
Because you don't believe in it. You need to believe in it.
You need to believe. Oh yes, you need to believe and support with all your will and all your might and all that.
So applying that to the pandemic situation, would you say that there was a conclusion that was handed out beforehand and then people collected essentially data or interpreted the data or made models to meet that conclusion?
Perhaps at first, in some instances, yes, and others perhaps not. It was juiced by experts, though. So it's sort of, there's lots and lots of good evidence now that the bug was created in these sort of gain of lethality experiments, or which they euphemistically call gain of function experiments, and was released accidentally on purpose, probably accidentally, but who knows. And so that there was that governmental class who spy on China, China spies on us, we all spy on each other, were aware that something was happening in the beginning. This is why the early rumors of when a bug was going around back in even December of 2019 were so readily embraced by all the power centers. Which is a strange thing because these bugs are always, every year, every week, if you just remember the headlines, there's always something new cropping up. And there was no reason to panic about any of these things, but panic about this one we did. So they might have had some inside knowledge. So they immediately went to their expert class. And the most infamous example, if I am allowed a slight digression here, is Andrew Ferguson and his Imperial College group.
Right, the big model.
He and his group have been trying to juice panics since 2001. He was forecasting doom in 2001 on the mad cow disease thing. They ended up slaughtering, I think it was 10 billion pounds worth of cattle and everything, which was later labeled a disaster. He tried to do the same with bird flu. I guess he predicted, I can't remember how many millions worldwide dead. It was like 347 in the end. Total people, over and over again. The swine flu, they tried to get that panic going. SARS-CoV-1, they tried to get that one going. And all of the time he's building these models, claiming there's going to be millions and millions and millions dead. And there were certain elements in the expertocracy and the expert class that kind of followed along and so forth, but it never stuck. It never got traction. It never picked up speed beyond just, planning and UN conferences and the like. And even the WHO, the World Health Organization, came out against all the ideas that Ferguson recommended in 2019. Nobody remembers, but they came out against all these ideas that were eventually embraced, like lockdowns and social distancing and mask wearing and all this kind of stuff. And then he finally, early in 2020, came out with that model, which panicked everybody, which sort of solidified what I think the ruling class had already come to convince themselves of, that this was going to be absolutely terrible. He was predicting millions dead in the United States by June of 2020, even if we adopted lockdowns, social distancing, all this kind of stuff. But it was a preposterous forecast in line with all of his others. At one point, I think if you look at it, which they didn't look at the model, they just believed it, it was predicting 56,000 a day dying from just this coronavirus. It's nuts, but it was embraced and believed, and the rest fell in the line in the regular stuff. Then solutions became suggested for all kinds of things, and we fell into our regular routine thing. But I don't think without that initial intelligence, we would have gone down the path that we did.
Mm-hmm. Now, most of what Ferguson was doing and what others, let's say, were doing, are using these models. And that's one thing that I think is really particularly interesting to talk about with you, given your expertise and the way in which you explain models and the way in which you critique models. So when people are forecasting, people are predicting, people are using these models, can you help explain to us what is going on with these models?
Yeah. One thing I always want if anybody takes anything away from this, it is this, that all models of any kind, in any situation, of any stripe, on any platform, artificial intelligence, neural network, machine learning, statistical, probability, physical, whatever, any model only says what it is told to say. That's the purpose of modeling. This is not a bad thing. This is a good thing. This is how we can have useful models. But the problem is, in our society, we have people saying, look at the results of this model. The results of this model have proved whatever contention that they that they hold. No, the contention was always a premise of the model. And the model can only say what it is told to say. Let me give you an example, a recent example. I think it was last week even. This came out of Harvard. They had a big, Harvard, wow, we have to listen to them. They're from Harvard. They had a big press release and everything that said, well, researchers have discovered that school children should continue wearing masks until some future point. Okay, so you download the paper. It's in, I think it was in Nature. Naturally, one of the most respected journals. And you look at the thing and they say, well, we had this blah, 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 some fancy model. And they hide all the results in the supplementary material. You go into the supplementary material, it says, this model assumes that masks have a 30% effectiveness over such and such. And this model assumes the vaccines have this and such effectiveness over this. They ran the model. The model assumed masks work. It then predicted masks work. And it was announced that masks work as if it was a discovery. Aha, we better keep masks on kids because look at this Harvard research has discovered for us. No, it was a premise to this dumb thing. They started out believing it. They had no choice but to believe it at the end. It's not any kind of demonstration of anything except that they know how to program a computer. That's it.
And you're saying this is the same of all models. So when you're saying models tell you at the end what you told them to tell you, when you're telling models what to tell you, when you're telling models what to do, that's in the form of these premises, these assumptions, basically these inputs into the model.
That's it. Any model starts with a list of premises or assumptions, data inputs that you stick in there, and rules for manipulating these things. You say, here's how to take this input. You see this and this input, you produce that output. You see a different set of inputs, you produce that output. That's what a model is. A model always says what it is told to say. Now, you can have a model that becomes so complex and so bizarre, you don't understand how it works because there's so many knobs and buttons and twists and turns in there, and you've got this enormous neural network or something like this, and you have no idea how all the connections fit together and so forth, and out spits this result, and that kind of surprises you. Okay, that's true. You can have that. But that doesn't mean that the conclusion is therefore correct. It doesn't mean that at all. The only way, and this is what science used to be up until a few years ago, the only way you know if you have a good model or not is to test it against reality. You have to use that model to make predictions of data never seen before or used in any way. And once you can demonstrate that that model is able to make skillful or useful or valuable predictions of that new, brand new, never used before data, then you have something. That's it. And that's the only case. Right.
So with something like the coronavirus and the models that were created for that virus, where do the parameters come from? Because obviously this is our first coronavirus that's of this kind. So where do they pull these parameters from?
Well, they make up a lot of them, most of them. The interaction, the social interaction stuff is just a bunch of assumptions that they get. You got to understand the way it works is scientists fool themselves most readily in any kind of complex area like sociology or medicine or something like this. Anywhere where the observables, which I call the observables, the people. Things like this are so complex, we never quite understand all the causes that are operative. So they build up a literature. They say, I think this model might be good. And they go out and they test a few college students or something, and they put a paper out. and it's never checked and nobody cares. And they just go on and on like this, and they build up a literature, each person referring to the other, just referring to all these papers, and they build up a body of literature that by itself becomes convincing because it's so large. But we require of all these people to publish, to put this stuff out just to keep their jobs and get grants and bring in money and so forth. It becomes a kind of a self-perpetuating thing. So in the coronavirus early models, I mean, they already had some of these things available from before, from their other earlier failed experiments, but they kept them and used them. And indeed, in this one, it was sort of infamous, not just in the results of the models itself, but in the code. They were asked to release the code several times, Ferguson's group. And they had to have, I think it was Microsoft or maybe it was Google. I can't remember exactly, but one of the big tech companies assisted them in cleaning the code up because it was a mess.
Too messy.
And several people independently looked at it afterwards and say, you couldn't even get the same result twice rerunning the thing. And I don't mean there are these kind of pseudo-random numbers that sometimes people use. Not in that sense at all, but it was so sensitive to the machine conditions and so forth that it would never give you the same result twice. It was a complete mess, but believed.
So this sounds almost insane. So most of what we've been subject to, particularly where we are, let's say in Ontario, Canada, we're hearing about these predictive models all the time. Yeah. All throughout the pandemic, there's these science tables, and they do these models. And what you're saying is, it's just basically some kind of circular logic, circular reasoning that you're just basically restating premises as conclusions as the outcomes of models.
Every single time, without exception. That's just a logical truth. You can't get out of that truth. That doesn't mean you can't have a useful model. So here's a model. Here's a very simple model. It rained today. Therefore, I think it's likely that it'll rain tomorrow. Mm-hmm. That's a model. Mm-hmm. It's a model. It has very good premises. It has this data based on about a lot of observations of my own. It's not entirely quantitative. A model doesn't have to be quantitative, and most of our models are not. But it's a useful model. It rained today. I think it's going to rain tomorrow. It's not always right, but it's useful. All right, so there we go. There's a model. So you
have an input, which is so your premise is it rained today. Is that like the input?
There are hidden premises in there. There are tacit premises. Therefore, because I've observed in the past times in which it has rained today, it has often rained the next day.
Right.
That's just a tacit premise of this kind of a thing, and it's completely loose. How many times? Well, who knows? I don't know. We don't have to have a quantitative. Probability and uncertainty does not have to be quantitative to be useful. And most of our judgments of uncertainty are not quantitative. And in fact, this is another thing you have to do. You have to force that quantification. You have to force that quantification inside your model in order to produce. That's just yet another premise that you produce the quantification at the end. The search for quantification in areas in which it cannot be quantified is also another thing that leads to drastic overcertainty.
So when it comes to, let's say, model complexity, so one of the things you hear about these models, like, there's like these really sophisticated, complex models. How is it that models get complicated? So you described a very simple model. It's going to rain. It rained today. I think it's going to rain tomorrow. And you get these like heavy computational models, and it seems like very sophisticated, very technical. It seems like what people often call like it's very cutting edge science. What makes models become complicated?
All right, that's an excellent question. Complexity does not necessarily mean poor quality. It could mean very good quality. And I'll keep with the meteorological example, because in meteorology, they're creating models all the time. All of these forecasts you see and so forth are the creation of extremely complex models that were built over a long period of time. But the advantage meteorologists have that other scientists do not have, if you want to call it that, is their models are immediately subjected to reality. Mm-hmm. Every day in front of your face. They said it's going to rain today. They said 100% chance, and it turned out to be perfectly sunny, not a cloud in the sky. Well, that's something. Or if you're saying the opposite, you're saying it's going to be sunny and your crops just got frozen. That's a bad thing. We need to fix that. Why did that happen? So these models have a lot of stuff built into them over the years. Our knowledge of cause, of what happens in the atmosphere, what happens when the solar radiation comes down, how it turns into the ground, and how the ground heats the air and all this kind of stuff, and how the air flows on a rotating sphere and thermodynamics and all that kind of stuff. It's all in there. And there's a lot of statistical manipulation too, to stuff that we can't quite calculate physically, because there's just, the atmosphere is way too big. So it's all in there, and it's always being tweaked and monitored and modified by an entire army of people who are dedicated to just that kind of a thing. So a complex model can be very good. The problem is with these other types of models that model human behavior is they're never or almost never subjected to external validation. So the practice has come up to create these models and then to fit the models to the data you've already observed, which is a prerequisite. You have collected data that allows you to try to identify what you think are the causes of that data. That's the point of science, trying to discover cause of the observations. And so you build a model, and then you look at how close that model fit that old data. Now, that's a necessary condition to have a good model, but it's not sufficient. However, that's where the majority of science in the complex fields, like medicine and sociology, education, psychology, and all, they stop. They calculate a distance measure between that old data and the model, and they say, well, if that's close, we're done. We're done. We don't need to prove anymore. We never need to test this model in any other sense. And that kind of stuff just builds and builds and builds and builds. And so when they build all that kind of stuff into these giant models, like they did for the social distancing models and so forth, you don't know what's right, you don't know what's wrong. It's just one giant morass. And for all the COVID models we've seen, the majority of them, by far, I did Canadian statistics as well, are overpredicting, I should say. They're overpredicting. They say, well, by this time there's going to be this many dead, and it turns out this many. And consistently overpredicting, and there's no real driving force to get them to correct those models to make them behave closer to reality, because that's the solution that's wanted. They want to have the worst situation as part of the package of predictions.
Mm-hmm. So you used a term, I think earlier, skillfulness of a model or model skill. So what exactly is model skill, and how does comparing it to data factor into that?
Skill is it's a technical term. I mean it in a technical way. It is your model's competence over a comparison. Almost always a simpler model. So for instance, now I could say I have this model here. I say it's going to rain tomorrow because it rained today. And that's similarly, I say, well, it's sunny today. It's going to be sunny tomorrow. That's a very simple model, right? Mm-hmm. Now, if you're going to go and build something that's more complex and more sophisticated and consume lots and lots of resources, if you and that sophisticated model can't beat that simple model of mine by whatever verification measures we're using, then there's no reason to use your model at all. Right. Why should we? I could just use mine. I'd save a ton of money doing so. And this is often the case, especially in medicine, especially with diagnostic tests and the like. It's much better often not to have a diagnostic test for screening, for instance. They're way overused for just this reason.
Right. So if you have a skillful model, that means that it matches data very well and better than other competing models. Is that a good fair summary?
Almost, except it matches predicted data better. It doesn't necessarily match the historic data, the data we use to fit the model.
Right, of course. Predicted, future data.
The predicted data.
Right. So that leads me to the next question, which is, in the case of something like the coronavirus, for instance, the data that you're trying to match are things like cases, deaths. And so a lot of it seems to depend on your ability to actually make accurate measurements in the first place so that you can actually verify these models. So what's your sense in this corona situation? Has the data been treated properly? Do we have a good understanding of the data has been measured properly so that we can even test these models properly?
Well, that's a softball question. The answer is, of course, no. Up until 2019, up until the beginning of 2020, in medicine, I've been doing medical statistics for over 2 decades now. A case was a patient who required treatment or sought treatment, say hospitalized, something like this, which was distinguished between an infection. An infection was just somebody who had contracted a disease like a common cold or a flu even, and never sought treatment, never needed treatment. So we immediately moved to calling all infections cases, which sounds much worse. And so we're still doing this. And all of the doctors placidly went along with this, which is bizarre. No one should trust me on this. Just go look in the old papers to look up things we used to call case fatality rates and distinguish them between infection fatality rates.
Mm-hmm.
Of course, case fatality rates are much higher. Naturally, the person's sicker. That's why they're requiring treatment. And therefore, if we're going to tout those statistics, it sounds like the thing is much worse than it really is. So, he who controls the data controls the science. And people are, the temptation to manipulate data in these cases has been very strong. I mean, we have the whole problem of, and it's a consistent problem in medicine. It's not a new problem. What did somebody die of?
Mm-hmm.
Well, they have 6 comorbidities, and COVID was one of them. Is that a COVID death?
Right.
Is that the lung cancer that they suffered from? Is it the obesity? Is it diabetes? It's not a clear-cut answer. There's no clear-cut answer there. So those statistics have been somewhat juiced, and there's all sorts of incentive to do so because hospitals are awarded more money if they have a COVID death, and it's more publicity, and you feel better about yourself, too, as a doctor participating in this great, massive, once-in-a-lifetime event. But on the other hand, a lot of doctors are very good trying to do this. Maybe the guy would have lived if he's got all these comorbidities, and this is just the proverbial straw, that kind of thing. That happens too. So what do you put? It's not clear. So we have to look at other things, and we can and do, like all-cause deaths. We look at deaths from all causes and try to figure out what's going on. There, but it's not easy. See, just because I don't want to get a false dichotomy going here that I say that these guys are over certain that therefore I have the absolute right answer. I'm saying nobody does because it's just too hard and difficult a problem, and that you can't go around running to pretend that you do have the right answer because of, and I have this in the book, the do something fallacy. We need to do something. And when often the answer is, no, you don't. You don't have to do anything. Just let things take their course. Mm-hmm. But that we've gone far beyond that. We're now much more feminized and effeminate, and we have to have government doing something for every problem that is propagandized.
So now to bring it back to the models and the comparison with data, do you have any sense or is there any evidence to suggest that these models were improving over time at all, given how many that were run and given the data that was being collected? Is there any evidence to suggest that predictive abilities were being improved at all?
For COVID, right?
Yeah.
Some places, the IHME has done a better job, and then when they seem to, you never hear about them again. They're never put into the press. You don't. Okay. Those studies, they're more along the lines of here's what's going to happen. They have good uncertainty bounds and so forth, and they're reasonable, and people make good predictions off them. But they don't get touted in the press. You're only going to hear the ones that say it's worse than we thought. There's a new variant coming, and it's 10 times as bad, and so on and so forth.
So the ones that have
you're only going to hear about those. So yes, some models have gotten better. The ones touted by the people who have become incentive to embrace the solutions, no, those models have not got better.
Right. So from what you're saying, it sounds to me, correct me if I'm wrong here, but the three of us, we could put together a model that shows that wearing masks leads to higher mortality rates. Sure. Simply by entering the assumption or the premises that masks result in X number of fatalities or whatever, and we could run it through some machine, add some numbers to it, and then we say, look, we got a model that proves or shows we found that masks lead to more death.
Absolutely.
That's
Simple as that.
Simple as that.
And then,
there's always going to be some literature out there, a way you could tweak an observation. There's been innumerable comparisons. You must have seen some of these comparisons of one locality that had a mask mandate in place and another locality that did not, that had a mask mandate. You know, one did and one didn't, and they plot a course of say so-called case rates or something like this. Well, there's always a point at which an area you can cut, and the ones with the masks, without the masks, had a higher, with the masks had a higher case rate. And you say, okay, there it is. There's my evidence that masks, you're just making a causal assumption now. This correlation now becomes a cause. We all have heard a million times, causation isn't correlation. Well, it does turn into, correlation does turn into causation whenever you get a wee p-value or a measure of goodness in your data. So it happens all the time. Nobody remembers it. Everybody only remembers it for the other guy. When you're applying criticism and critiques of the other guy's model, you remember it. When you do it for yourself, it just goes out the window. So absolutely you could do this. In fact, this is just to continue this example. This is the proof I'm going to tell you that masks don't work, which everybody could see for themselves. If masks work, masks would have worked. We've had 2 years of this stuff all over the place, and there's not been any evidence in any way that masks have worked. You only have to, the only time people claim masks work are two types. In these obscure, bizarre kind of statistical studies where you have to look and squint and get right down into the data and look at some obscure parameters of something that might have some wee people, just meaningless stuff that doesn't translate into real things. Or you have a bunch of physicists who couldn't help themselves. They want to get involved. They strap some mannequin to a chair and fit a mask perfectly over him, set up wind with parameters. They measure the wind exactly. So they measure all this physics real well because that's what they know how to do. And they look at these particles and blah, blah, which is absolutely useless, has nothing to do with people. But that's the stuff you get kind of touted. But they can't help themselves. They just got to do this. This is the problem. This is the affliction that academics suffer from. They must, and this is true, this cliche is true, they must publish or they will perish.
So with all these people, with all these modelers out there, how do we make sense of this? So are they completely tricked by their own models? Or are they?
Yeah, you know, a guy who... Look, these guys, they argue like this. I'm a smart guy, and I'm working with a lot of smart guys. And that's a true premise. I grant this premise. I'm not saying it's not. And we created this, and we have a bunch of dummies who are criticizing us. And they don't have the training we have, and they're not as smart as we are. They don't know what they're talking about. Therefore, I must be right.
All the while, they're just doing the circular
and the criticisms that, look, your model's not matching reality. It doesn't matter. Falsification in science is a red herring. It doesn't mean anything. You never, this idea of falsification never, ever works. It doesn't work. You could say this reality has falsified your model. No, never. There's always a million excuses why that doesn't count as the falsification. That data wasn't measured quite right. The person who did it worked for a Republican. Oh, they had a red hat on. They had a truck and they honked it at me at the intersection. Who knows what? Or the data wasn't, the moons weren't aligned right when the data was taken. And the stuff is so complex that falsification never works. Never works. You have to, it's a matter of power. You have to hit these people over the head time and time again, and to show them that there are superior models. And of course, if we can't demonstrate a superior model, which often we cannot in these complex situations, they're going on to believe that their model is therefore the only one that we should be using because of the do something fallacy.
So these models, these models for COVID, I mean, they've failed spectacularly. Many of them, and they seem to fail over and over again. And when I engage people about that, they kind of make some excuses, but they say, "Well, we got to be, we got to be cautious, right?" Well, they either say reality wasn't as bad because of our interventions and they worked. Okay, they'll use that argument, but the other argument is, well, we just have to be cautious. Can you speak to this precautionary principle and the logic behind that?
Yes, I can. The precautionary principle is the philosophy that the worst possible thing that can happen might happen. And therefore, the cost that you pay to guard against this worst possible thing is worth paying. So it becomes purely a matter of how fecund your imagination is, how frightening you could be, what kind of ghost story that you could tell yourself or others to convince them that you have to protect. There is nothing to be cautious about. There is no threat until you've identified the threat. You can't say, well, we need to, because you can always imagine there's always going to be the possibility a new bug develops that is worse than the Spanish flu, for instance, or becomes like Ebola respirized or something like this. This is always the possibility. Anything can happen. Anything can happen. That's the point. And you can always talk yourself into it. And you can't say we need to be cautious about that. It just doesn't work, because you can absolutely always conjure something that can be so awful that we need to be cautious about when there's no evidence for it. What's the best evidence we have for this, and do we need to act on it? So it got so bad. There's some guy in the United States, people know about Taleb, Nassim Taleb, the black swan guy and so forth. He argues for the precautionary principle for this, and that caught on early in the pandemic too. And he said, if you're not panicking, you're a psychopath. He said this in print in a paper.
I remember that.
So you're a psychopath if you don't believe into his the fantastical world that he created for himself. Well, he became like a lot of these scientists. He fell in love with his model. This is just the old tale come alive. I mean, they create these models. They love them. They've worked hard on them. They invested a lot of time and sweat and mental effort. And they're not going to see these things criticized. It's just not done.
Right.
The old saying that was, science advances one funeral at a time, for a very good reason, that people don't give up. It's only that you convince new people coming into the field that the old ideas are wrong.
Wait, you mean scientists aren't these impartial, objective, welcoming of criticism individuals? They just love it. They just want to self-correct all day.
Absolutely not. That I think David Berlinski said it best. He said that kind of view is all right for a PBS special, but that's not the way it works.
Not at all. Yeah.
Ever. It's just as brutal and cutthroat as in any profession, except it's worse. Scientists really are smart guys, and they're very good at defending their ideas. So it's as nasty as you can bet. There's politics in the old-fashioned kind of sense of office and grant politics and all this kind of thing. Absolutely. It's only that stuff that it works when some other guy comes along and manages to come up with a new idea that's so compelling that new people take it up. And that becomes the sort of predominant view for however long it can manage to hold on. The problem we have now is that we're not doing science that way. We're starting from the conclusions which are just given to us as true. All right? And so this is Lysenkoism. If you like, we're there. We can't criticize in the old ways that we used to.
Just going back to the precautionary principle for a moment. So people, they advocate for the precautionary principle, and then they implement some sort of intervention, right? Why don't people apply the precautionary principle to the intervention? Meaning,
yeah, absolutely right.
Yeah,
that criticism is made all the time. But you don't understand that doesn't work. You don't get to apply it to my fantasy. I get to keep my fantasy. My fantasy trumps your fantasy because I'm the one who's aiming towards the solution that's wanted.
Yeah,
your solution is what's wanted.
Yeah, it's like there's an ignoring of all the different possible costs and benefits. So people aren't thinking like economists in terms of all the possible costs and benefits of the intervention. They're really just thinking in a very myopic, narrow way about will this intervention reduce the numbers of outcomes that I've predicted from my model? And it seems very odd. Yeah,
that's the point. The apocalyptic scenario you paint in the precautionary principle costs so much that whatever little interventions you have are trivial compared to this thing. So there's no point arguing about those little tiny things. Let's just instead talk about defeating this much, much larger thing. So there was absolutely none of that done, even with these other models, which were not sort of precautionary based. There was no cost benefit analysis on locking down.
Right, locking down especially,
the curve, all this kind of stuff. Never done, ever. And it's still to this day, it's just this stuff just doesn't exist. And by the way, those are projecting those things are just more models.
Right.
Again, so you have to look at it from that kind of a sense too. It doesn't necessarily mean if somebody comes out with this that it's therefore correct. Because I remember now, it was in the summer or late fall, or early fall rather, of 2020, some academic group came out with a paper that said not only were lockdowns not economically harmful, we gained trillions with a trillions of dollars because of this.
Based on a model?
Based on a model. It was one of the standard top tier universities, and my mind is blanking on which one.
So we've constantly heard, we got all these politicians getting out there and saying, we got to follow the science. And the science that we're seeing them following is model-based science, basically. We got these forecasts, we got these projections, we got to do these things, we got to implement these restrictions, we got to implement these vaccines because it's going to bring cases down, hospitalizations down, all that. Is there anything scientific about models or modeling? And if so,
science is modeling. Science is modeling. Science is modeling. Science is trying to ascertain the cause of physical observation.
But these predictive models.
But there's nothing about following the science. Science never tells you what to do, ever. Tells you what's best to do, tells you what's right to do or wrong to do. So when these leaders say, we need to follow the science, we're following the science. No, they're not. They have come to a moral or ethical judgment independent of science, and then they have found corroborating evidence in some model that backs them up. Science never says which is right or wrong, ever, in any way, ever, not even a whisper. That view that it does, that following the science tells you what is morally best to do, is scientism. It's just not right. So what these people saying they're following the science is just confirmation of what I've been telling you. They had in mind the solution, and they went and found the science to back it up. Now, what we really need to do is argue about was the solution that they came up with the right or the wrong one. Mm-hmm. And we could use science observations and causes to inform that. There's no problem with that. Because, look, we didn't panic in 1958 in the Asian flu pandemic, which killed about 4 million people, when there was a third of the population on the planet, or a decade later, which also killed maybe 2 to 4 million people in the Hong Kong flu. No panic. Nobody remembers them. Nobody remembers the response, which was no response. There was vaccines then too, but no vaccine mandates and all that kind of stuff came out of it. And they went away on their own. Now, why is that? Why did they go away on their own? Let's think about this before we rush headlong into these absurd solutions that you have designed and we can now see done nothing.
Mm-hmm. So, Dan, you had a question, or?
I just want to squeeze one in there and just ask, what exactly is scientism? How is scientism different from science? I think our audience would want to know that distinction.
Yeah, sure. Scientism is the belief that science can tell you what is right or wrong to do, that moral judgments are behind scientific observations, that ethics are behind a scientific model. No, none of that's true. Science is, because you know the weight of the neutrino, assisted suicide is therefore wrong. Does that sound like a logical argument to you? Mm-hmm. That's an absurd, exaggeration of one, but knowing a particular fact or the cause of that fact doesn't tell you what's right or wrong to do about that fact.
So people have a belief system, and they're kind of piggybacking on science and then essentially gluing their beliefs to the science and saying, and then using the authority of science to advance their beliefs.
Yes.
Is that the idea?
Absolutely. That's better stated than I could have done. Absolutely right. Mm-hmm. And now the authority of science has, rightly, been wounded grievously.
Yes. Yeah. As a scientist, that really bothers me, actually, because I think we've actually, as a field, lost credibility. For those people who actually look closely and notice the difference between the evidence and the conclusions and the implementations, now they're looking at science and saying, what are these boneheads doing?
Well, just to give you one more example, if you don't mind, yesterday there was a German physicist woman who was writing a grant. I wrote about this yesterday. She was writing a grant on inflation, cosmological inflation, what happened right after the Big Bang in the early universe. And the granting agency asked her to put in words of how inflation was related to sex, gender, and diversity. Now, how is this cosmological mathematics, this extremely arcane, bizarre stuff related to sex, gender, and diversity? Well, there again, we have the solution driving the science. It's an obscure kind of a thing, but now she has to, if she doesn't include that paragraph in there, doesn't lie a little, doesn't play along with the game and die a little inside from the lie, she doesn't get the grant. And somebody else who is willing to lie or play along and is therefore doesn't have the same scruples and honesty is going to get the grant. And it just corrodes. It's becoming more and more political. And it doesn't seem to be anything arresting it in the West anyway.
So yeah, it may seem as though that, let's say, that pattern of, let's say, obedience and conformity actually may have it kind of sets the table for subsequent going along with the next thing and the next thing and the next thing. That you don't ever, we talked about this before, you don't ever get, if you disagree or you're going to be non-compliant, at some point you're going to get screened out. You're not going to be there to apply for the next grant.
That's it. That's exactly it. And there's going to be the next thing, whatever it is.
Right.
It's always going to be there.
So is this a good time, Dan, do you think, to switch to probability?
Sure. Yeah.
Do you have any more model questions, or?
I think I'm modeled out right now.
Modeled out. So Dr. Briggs. Dr. Briggs, one of the things I wanted to talk to you about today is something you've written about and explained. Is this idea that probability doesn't exist. And I've been going around, I've been telling people that probability doesn't exist and saying probability doesn't exist, pass it on. And they look at me like I'm crazy. Can you explain to us how it is that probability doesn't exist?
Certainly. I'm not the first person to have said this.
Right.
DiFinetti back in, I think it was 1917, 1920, I can't remember the exact year, first boldly put it in print, all cap boomer type letters, probability does not exist. Let me just ask you this question. What's your probability of being struck by lightning?
Right at this moment?
What do you mean? No. You have, if probability exists, you have a probability of being struck by lightning. What is it?
I'm going to say it's, I don't know, 17.
Okay, 17. Now, is this something in you? Is this probability
I carry it around with me every day.
Is this something you carry around? So now you're going to go out on a golf course on a thunderstorm day.
Yeah.
Yeah, there you go. You got it in your pocket. Is it something we could measure? Is it something I could look at in some way and find out? Now you're going to go on the golf course. It's raining, a thunderstorm, and you're going to go stand under a tree. Now you kind of hinted at it. Does your probability change?
Yeah. I'd say, yeah, it just changed.
Nothing's changed about you. You're still the same. So you don't have a probability. It seems that the circumstances, the causes that might create lightning have changed. So cause has changed. And the things associated with cause have changed. You yourself have absolutely no probability whatsoever. Here's another example. I have a unicorn and a dragon in a room. And I'm going to pull one out. What's the probability I pull out the unicorn?
It's 50%.
Okay, yes, I agree. You can deduce this from the so-called statistical syllogism. Now, where is the probability in this? There is no probability. It doesn't exist. It's a matter of epistemological measure of uncertainty that may or may not be quantified given fixed premises. Given fixed premises, we deduce the probability of some proposition that we have, like being struck by lightning, or picking a unicorn of a room, or something like this. We do this in logic all the time, just logical arguments and so forth. We have no problem doing it in logic. But all of a sudden, people then sort of believe that chance might become ontological, might become an operative causal force, because systems are so complex that we humans are interacting with all the time, that there has to be a cause for these things. We don't know it, and therefore we put it down to probability. Probability becomes a cause in these models, in these ways of thinking about things. But probability isn't a cause. It's just a measure of uncertainty, and your thought can't change a cause in that way.
So with the pandemic, let's say, and things like risks, you hear a lot of, let's say, probabilities perhaps getting thrown around. You have a certain probability of catching or dying from or being hospitalized from. Is there a way to apply that to how we understand some of these
That's
issues?
the problem. We shouldn't be doing that, but we do. Yeah, they say you have a 30% chance of dying from COVID.
Right.
If you get it. There's always a set, probably a very large set of premises that are attached there that are not being spoken. They're tacit or implicit. That have a lot of data from which somebody has deduced that conclusion that you have a 30% chance, given this set of premises and the rules for operating on them. That's it. So that's always hidden. They just say, no, you have a 30% chance. No, you do not. Nobody has a 30% chance. This allows people to exaggerate. Mm-hmm. We can look at the number of people, for instance, who have died and their ages and so forth, but we still can't say a 70-year-old person has 2 times the chance of say a 40-year-old person. We can't say that. What we can say is in this data we have seen, this is the case. And we could make a prediction that if all we know about a person is their age, and one person is 70 and one person is 40, and that's all we know, then this person has a probability conditional on the premises that I've assumed higher than the 40-year-old. That's it. Mm-hmm. Probability becomes just like a model in that same sense. It's entirely dependent on the premises that you assume, and that includes not just the premises of the model statements themselves and that kind of a thing, but the tacit premises that you have on the meaning of the words, the definitions of the words. What do the words mean, and the formation of the proposition that you're trying to say? What does it mean to be struck by lightning? It sounds straightforward, but you could start piecing that apart. And does it mean struck exactly on the head? Does the bolt have to hit you, or can you be nearby? And all this kind of stuff. So all of this stuff always folds in there. We just use this way of speaking in a kind of manner of speaking. Mm-hmm. But it's it sounds precise, but it's incredibly imprecise.
Right.
And it would seem that the temporal interval has something to do with it as well. So when people made these corona probability claims, right? I mean, if you look at the Pfizer trial, for instance, they looked at data, into I think it was the first 2 months, right, after receiving the vaccine. And so you get some numbers there, but what does that mean for 6 months and 8 months? And so if somebody says your probability of getting, COVID is like 1%, like, is that this year or in my lifetime or in the next, right? So I never could understand what exactly those numbers were referring to. I suspect they meant like in a year, but what that was never clarified.
They meant over the same time period of the study period, but that part
the study period
got I read those initial papers and wrote about them back in December of 2020. Looked at those. They were claiming like 95% efficacy for infection, which is absurd. Which is vaccines. Everybody should know this by now. Why we don't, I can't fathom. Vaccines never prevent you from getting infected. Why are you taking a vaccine? Not to prevent infection, but to protect you after infection. If you're infected, then your body, if it's learned well from the vaccine, can marshal its resources and defeat the bug. But it doesn't. I've always found this analogy. It doesn't. The vaccine produce you some kind of an aura, an electric aura around you that, like a bug zapper, when the virus gets near, it zaps it so you can't be infected. Yet we had authorities. The American CDC director, Walensky, say, if you take this vaccine, you're 100% protected. Fauci, the fabulous Fauci in the United States, he too said the same thing. And President Biden, you're not going to be infected. Over and over. And it was just one shot in the beginning. That was good enough. We had experts coming up immediately saying one shot's good enough to prevent you from being infected. Now, no, what they really mean, the doctors who wrote the papers are careful about it, means that you won't show a positive test in some window after exposure. It doesn't mean that you're not infected. It just means that the virus would be of a low enough level in there not to show on this and such test. Mm-hmm. That's all it means. But it became enormously abused, and our leaders, rulers, went for the noble lie, decided not to correct these lies, and let them fester out there because they wanted to push people along their solutions.
I guess one assumption that they could have made is that if you take the vaccine, it may reduce your overall viral load because it'll prevent the virus from replicating, right? So some of it gets in, but then your immune system gets at it very quickly, so you don't develop as much. And so it's this idea that what you're doing is somehow reducing chances,
Sure.
the probability of spreading. And I think the logic, because I actually heard this analogy, the Swiss cheese models of intervention, or the Swiss cheese model of intervention. And the basic idea is that none of our interventions work very well. But if we do all of them together, somehow we're going to achieve a really good result. And so that I think that kind of argument. A is a
fallacy, B is a fallacy, C is a fallacy, D is a fallacy. But if we do them all at once, they turn into
right.
Yeah.
I think they're assuming that if you get even 5% improvement from wearing a mask, and then another 5% from your vaccine, and then another 5% from distancing, and another 5%, right? Then now we're like 15%. But again, the temporal interval matters here, right? Because you got to keep living. So that 15% is going to get you over time, right?
Yes,
so,
you're quite right about the viral load. You'll get the virus, you'll still be infected, and the hope is that it doesn't develop into a large enough infection that it's going to harm you too much. It'll harm you to some extent. Of course it is. When you're infected, you're harmed. But that's one, and that's a true statement. So if we only were to vaccinate, which we should have done, only the eldest people, elderly and infirm people, we would have been okay and help reduce the spread. But the problem is, you get this vaccine, you're now feeling fine. You're carrying this viral load around with you, but you don't even know you have it. And now you're spreading it. You're spreading it even faster than you would have if you would have just taken to your sickbed. Not only that, it then allows variants to develop to become immune to the spike model protein in these various types of either mRNA or adenovirus or other types of vaccines that were used in this thing. Mm-hmm. So all of that was there, but they decided not to think about those things, which were known in vaccinology for decades. They just decided to bypass all that and say, no, you must have it. You must have it. You must have it. They went with one line. And again, they went with the solution and cut out all possible other explanations.
Mm-hmm. I get this this theme that's coming out here is that we are all taught to trust the experts, that the experts somehow know they have the answers. But what you're saying is that in many of these domains, actually, the experts are driven often by ideology. Not all of them, but it's a big factor. And that leads to all of these. And they're also got pressure from politicians and whatnot. But that then leads to these bizarre outcomes. And I think for our audience and for a lot of people out there, that's very shocking. The fact that the experts have let them down or are letting them down, I think that's such a shocking conclusion.
It unfortunately is the correct conclusion.
Yes.
You stated it perfectly. I can't say it better.
So we don't want to keep you much longer here. I think we're coming up on an hour. Got so much more to ask you. I was wondering if you, in the last little bit, if you can comment on something that I think is particularly pervasive with a lot of the themes we've covered, is this idea of the reification fallacy. And can most, if not all of what we've talked about, be chalked up to a reification fallacy?
Or maybe start with anyway. The deadly sin of reification. That's reification. That's what I call it. Yes, this is mistaking the map for the territory. This is mistaking the model for reality. To the people that create these models, like I say, they love them, and the model becomes just as real. Or even realer than reality. This is why you cannot use any kind of falsificationist tactics to destroy the model, because there's always a way to find, to re-love that model, to patch it up, to make it good again in the eyes of its beholder. So the deadly sin of reification happens all the time when people ask you again to follow the science. The model just is only a slice of these very complex bits of life. And it doesn't even mean they've nailed the cause right. Even if the model makes good predictions, useful predictions or skillful predictions, it doesn't mean the model has necessarily nailed the cause of the observable or the causes of the observable under interest. It doesn't mean that. For instance, I go back to that silly weather example I've given you. I haven't said a word about cause in my, if it's raining today, it might rain tomorrow. The rain today is not causing the rain tomorrow. The sun today is not causing the sun tomorrow. The causes are myriad and difficult and complex. So, but I could still make good and useful predictions with this model, even though I don't know what the causes are. But I wouldn't say, therefore, now you could add a reification on top of it. I have to wiggle my rabbit's foot every time it's raining today, and then it'll rain tomorrow. Now I'm saying the reason it did, when it does, is because I wiggled it right. Okay, we are all taught in school to look at those kind of ideas with skepticism and credulity. However, when it said instead, if I put it in a computer and do it, why? Then now we have something. It was on a computer. How can it be wrong? So we do it the same thing. It's just we follow the same superstitions now, just with electronically.
Just a speculative question. Do you think that this tendency is getting worse as, you refer to like the laptop class? And I read this one article yesterday making a distinction between sort of the physicals and the virtuals in terms of classes of people. And let's say the expert class, let's say, is getting more and more virtual.
Yes, I saw the same article. Yes, absolutely. Definitely. The Zoom class, the people who live class, on these abstractions, they live in groups, these people on universities and in towns, and they all have these same abstractions. They all trust each other. Each expert trusts each other expert in their field, so that the doctor is trusting the physicist and the physicist is trusting the chemist and so on and down the line. And they all have these abstractions that they live by, these models, and they become more and more abstract, and they're becoming more and more directed towards the solutions. But they all trust each other, and they trust them over even reality itself. Mm-hmm. And they're not actually confronted with reality that often. That's the point that we're all trying to make here. Lyons. Is it Lyons? That's the gentleman's
I think,
name?
yes. Yeah. Yeah. That's right.
Yeah. And so they never confronted with reality, and the way science is set up now, they're not really required to in a lot of these fields, especially as they become more ideological or they become more solutions oriented. There are still fields. I don't want to say this is all of science. I'm not saying that. I don't want anybody to get that idea. There are still good people doing good work in lots of areas, but as this infiltration grows, they're going to be corrupted too if they're not careful. Even mathematics. Mathematics has now become what you feel about a solution and not the solution itself. This is inevitable when talent for doing mathematics is not distributed equally, but you believe you have the ideology of equality, in which everybody is a blank slate, and only if they were raised in exactly the right way, predicted by these experts, everybody would turn out to be the same, or everybody could learn to the same level. Now, this is absurd. There's nothing in history that gives any indication it's true. There's never been a single observation to prove equality or anything even like it, but it is believed and ardently.
I might be able to come up with a model that proves that.
You can.
You know what this sounds like, though, is that there is actually a fundamental reality war at play in the West. Right. And it's like everybody's trying to articulate what reality is, but then there are groups of people that work off of different kinds of models, and maybe those are magnified by the media. Right. And then there are others who have a different model. And so, is that an accurate representation of what might be happening, especially with Corona?
Absolutely. The postmodernists, they got one thing right. A model in science is... You can never make an observation that's not biased in some way towards something. You need a model to make an observation. All right. So I think I'm going to I'm abusing this stupid example, but because it is stupid and easy to understand, I think we can all grasp it. So now, and I want to complexify or make a little bit more difficult the weather forecast model. Now, should I be looking at the color of socks that I see the next person walking down the street wear as part of my model? Now you're going to say, well, no, that's absurd. Why should I? Because you have already thought that through. That has nothing to do with the cause of rain in the atmosphere or something like this. But now you had that model already. In other words, you had that idea of the cause in your head already when you have described this observation as absurd. So you just magnify that, and it becomes very subtle at a very intricate level. But it's always there. We can't get rid of it. So this tendency is inescapable. It's inescapable. And so there's nothing morally wrong with it. We can't get away from it. So we just have to be very careful about defining first what is right, what is good, what is the meaning of the good, what is bad, what is evil. We shove all aside to start telling people to learn science instead. And that's a complete mistake, because the scientist comes to believe his own press and his own PR and forgets that his idea of morality and right and wrong and all that kind of stuff are not necessarily the right ones or shared by anybody else except his Zoom or laptop class.
Well, that's a great note to end on, I think, because
I agree, yeah.
We're just rolling up on the hour. And I just want to suggest that everybody get these very fantastic books. This book right here, The Price of Panic. I read that almost as soon as it came out, and it was a fantastic read. I really enjoyed it. And you were actually confirming a lot of the things I was reading as well. So I was glad to read someone else, very eloquently talk about these issues. The one I haven't read yet is Everything You Believe is Wrong. And we like to talk about solutions on this show, the solutions to various kinds of problems. And one solution for everybody would be to read this book so that you can learn where your thinking has gone astray.
Another place I'll plug is your website, WM Briggs. It was a place early days in the pandemic, particularly 2020. This feels like 25 years ago. That was definitely a place of sanity and reasonable prediction. See what was happening, and it was a wealth of information. There's a lot of back catalogs, a lot of information to check out there as well. So thanks so much for joining us today, Dr. Briggs.
My pleasure. Anytime.
Thank you.
Thank you.